Today we are discussing hair, all the ways that science has taught us we can slow or even reverse hair loss. Can reduce hair loss in 90% of all people that take it. And in addition, it's known to increase hair thickness by about 20 to 30% overall. The combination of microneedling and minoxidil has been shown to be effective in recovering what are called dead zones, regions of the scalp that are either completely bald or mostly bald. So we will talk about hormone-related hair loss in both men and women. We will talk about some of the mechanical and stress-related influences on hair loss. And we will talk about the chemical and mechanical approaches to halting and reversing hair loss. I will also dispel some of the common myths about balding and hair replacement. If you've heard, for instance, that you inherit your patterns of balding from your mother's father, that is not true. It is not the case that you can simply find a photo of your mother's father, say at age 50 or age 60 or 75, and determine whether or not you'll have the exact same pattern of hair loss. So that's a myth that I'd like to dispel right here. Most people who experience even marginal hair loss undergo pretty severe anxiety. It is true that our psychological well-being can impact both the coloration or lack thereof and the growth rates of our hair. That's a real thing. And the reverse is also true, which is that as hair starts to thin or fall out or change color, many people experience intense anxiety or even depression. There are many accelerators on hair growth, but the first one that I really want to underscore is blood flow itself, which equates to the delivery of nutrients and oxygen. This is very important, and it explains a lot of the treatments for halting and reversing hair loss. For instance, one of the longest standing treatments for halting and reversing hair loss is so-called minoxidil. Minoxidil has been shown to be effective at slowing rates of hair loss. It's creating more blood flow to the hairs, which, because minoxidil does have this positive effect, at least most people would like to slow their rates of hair loss on their scalp anyway, it tells you that blood flow and delivery of oxygen and other nutrients from the blood is pretty critical, if not very critical, for the support of the hair growth cycle itself. If somebody's going to use minoxidil in order to try and slow or reverse hair loss, and again, it mainly is going to be used to slow rates of hair loss, not to actually reverse hair loss, the really key thing is to get that dosage right. The ranges of oral minoxidil that you'll see out there and that people take range anywhere from 0.25 milligrams all the way up to 5 milligrams per day. The topical minoxidil is also found in various concentrations. The typical concentration is going to be a 5% concentration that people will use once per day. It's also important, by the way, if you're going to take this route, that you actually leave that solution on the scalp for 3 to 5 minutes. This is important and should make complete sense as to why it's important. You can't just rub the stuff into your head and then rinse it off and expect it to be absorbed. It actually needs to seep down into those hair follicles and access the niche. How do people arrive at the correct dosage for minoxidil? Well, for better or for worse, really. In some cases, it's accomplished by finding out that you have an unwanted side effect, like dizziness or swelling of your ankles or edema, or I would hope this wouldn't be the case, but something that suggests there's hyperprolactinemia. You could get a blood test to measure your prolactin, or you perhaps notice a drop in libido or some lethargy, these sorts of things that are common to reduce levels of dopamine, increase levels of prolactin. I would hope that if people are working with a physician, or if they're not in taking minoxidil, that they would start with the lowest possible dose. So for oral minoxidil, that would be 0.25 milligrams, and then increase it as needed rather than jumping in right at 5 milligrams, because some of those side effects, in particular the fluid retention and the hyperprolactinemia, can be pretty uncomfortable and can disrupt a lot of aspects of life that most all of us consider desirable. A different type of treatment, which is a mechanical manipulation of the hair follicle. And one way that people are doing that is through mechanical stimulation of the hair follicle and the stem cell niche using what's called microneedling. Microneedling, as the name suggests, is taking a bunch of little needles, either in a little stamp, so a little square, or nowadays typically it's a roller. So it looks like a paint roller, except it's got tons of little needles in rows all over that roller. Those needles range in length from 0.5 millimeter to 2.5 millimeters. Okay, millimeters. And one rolls that over the scalp. And if you're thinking, ouch, that probably hurts. Indeed, it can hurt a little bit or a lot, depending on the thickness and the length of those needles. Microneedling has been shown to do two things. It has been shown to reactivate semi-quiescent populations of stem cells that are in that telogen phase, putting them back in anagen phase, and thereby stimulate more hair growth. It has also, and this is, I think, the best use of microneedling, it has also been shown to be a very effective augment for some of the hormone-based hair regrowth tools and pharmacology that we're going to talk about in a few minutes. For those of you that are interested in using microneedling or microneedling in combination with chemical treatments like minoxidil or some of the other treatments we'll talk about in a little bit, I was also able to glean from this review and some of the papers described within it that needle lengths of about 1 millimeter to 2.5 millimeters seem to be more effective than shorter needle lengths. So if you're scared of the needles and the needle lengths, keep in mind that done properly, microneedling shouldn't be too painful. Some people experience a little bit more pain than others, but it's not considered a very painful procedure. One thing that's very clear is that the combination of microneedling and minoxidil treatment together is far more effective than either of those treatments alone. In addition, the combination of microneedling and minoxidil has been shown to be effective in recovering what are called dead zones. So these are regions of the scalp that are either completely bald or mostly bald, for which there is essentially no stem cell population there. And the combination of minoxidil plus microneedling is somehow able to recover those stem cell populations and allow new hair to grow. Although the growth of that hair in those dead zone regions can take a very long time, 30 to even 50 weeks. So this, I would say, is a strong reason to consider combining microneedling and minoxidil as opposed to just doing minoxidil or just microneedling. I should also mention that minoxidil treatment, if you pursue it, is likely something that you are going to have to do for the rest of your life if you want to hold on to the hair growth that you obtain with minoxidil, or if you want to maintain the hair that you are already maintaining with minoxidil. Some people have been successful in taking minoxidil, maintaining some hair growth, or even stimulating some hair growth, and then coming off minoxidil. But most everyone who goes on minoxidil has to stay on minoxidil, because when they cease taking minoxidil, even if they're doing other treatments, they lose the hair that they gained with minoxidil. Why would people lose their hair when they're older and not younger? The answer lies in the conversion of testosterone to dihydrotestosterone. Testosterone, most people have heard of, dihydrotestosterone, or DHT, is made from testosterone. There's an enzyme called 5-alpha reductase that converts testosterone into dihydrotestosterone in both men and women. Testosterone levels are higher in males and females at younger ages as opposed to older, but as they get older, there is more 5-alpha reductase activity, which is converting more of that testosterone to dihydrotestosterone, and dihydrotestosterone inhibits hair growth by reducing IGF-1 and cyclic AMP. Well, then we should all be aboard why it is that by age 50, about 50% of people experience pattern hair loss. That is androgen-dependent alopecia. Okay, but translated to normal English is pattern hair loss. Reducing DHT should increase hair growth because of the negative impact that DHT has on the hair follicle. The major player in this whole story around inhibiting 5-alpha reductase and reducing DHT to maintain or increase hair growth is going to be finasteride and its close cousin dutasteride. Finasteride is effective in reducing DHT because of its actions in reducing the type 2 isoenzyme or isoform of 5-alpha reductase. And in doing so, it can increase hair count by as much as 20%. Pretty remarkable if you think about it. In addition, finasteride treatment done properly, which we'll define in a moment, can reduce hair loss in 90% of all people that take it. So that is, near staggering. There aren't many pharmaceuticals out there that have that kind of efficacy. Really dramatic. And in addition, it's known to increase hair thickness by about 20 to 30% overall. So not just create new growth of hairs and thicker hairs, but whatever hair you do happen to have on your head, it can further thicken those. So the issue with finasteride is twofold. First of all, it is known to have some pretty significant side effects if it's not dosed properly and in particular populations of people. I also should point out that finasteride comes in two major forms. There's an oral form and there's a topical form. So this is not unlike our discussion of minoxidil earlier. Topical finasteride is typically taken in 1% solution or ointment and rubbed into the head. Sometimes it's now also incorporated into shampoos, but typically it's put into a solution that people rub into their head. And it is thought that the 1% solutions are equivalent to 1 milligram of systemic finasteride. The issue is also that topical application of finasteride is harder to dose than oral finasteride. I'm not saying you should be taking oral rather than topical finasteride, but keep in mind that the dosages of finasteride that have been shown to be effective for inducing hair growth cover an enormous range. So as low as 0.01 milligrams per day and as high as 5 milligrams per day. Now, in trying to simplify the problem of how much finasteride to take, either by way of oral tablet or by way of topical solution, we can get a bit of leverage on this by thinking about how much DHT reduction occurs as a function of dose. And there, finasteride shows this really interesting, what's called logarithmic distribution. What it means is that for a dosage of 0.01 milligrams of finasteride, you're going to achieve approximately 50% reduction in DHT. And that's systemic DHT. So this is a blood draw measuring your DHT, then taking 0.01 milligrams of finasteride. Again, 0.01, very low dose of finasteride for a period of a couple of weeks. Measure people's DHT in their blood again, and you see that it's reduced by 50%. However, at increasing dosages of 0.2 milligrams, 1 milligrams, 5 milligrams of oral finasteride per day over the same period of time, the increase, or I should say the reduction in dihydrotestosterone doesn't increase linearly. It's not that you go from 50% to 60% to 75% to 100% with each increasing dose. It tapers off. It kind of flattens out. It tends to increase a little bit, but it's sort of a gradual slope increasing as you head from 0.2 milligrams out to 5 milligrams. So what this means is that given that reducing DHT can cause various side effects, sexual side effects, reductions in either sexual function or sexual drive, as well as overall drive and motivation, sometimes even some depressive symptoms, that everything points to taking the lowest effective dose of finasteride and starting with a very low dose of finasteride, because low doses of finasteride, even at that 0.01 milligrams taken orally daily, are already leading to a 50% reduction in dihydrotestosterone, and thereby, taken for a long enough period of time, should offset hair loss and stimulate hair growth.